The South African Employment and Labour Department has so far recorded only 50 deaths in workplaces. Now, this is despite the over 50,000 COVID-19 related fatalities in the country. According to the department, the compensation fund hasn't seen a surge in the number of claims lodged, with only 19,000 reported so far. The Chief Inspector at the Department of Labour, Tibor Szana, joins us now to tell us more. Good evening, Mr. Szana. Good to have you once again. Now, this seems like quite a surprisingly low number. 50 people in the workplace dying from COVID-19. Won't you elaborate on that for us?
I would love to, and thank you for the opportunity. My latest figures that I have is 52 fatalities, and of course, those are rather unfortunate. While that is the case, you can see from the figures that you've mentioned that it is a fraction indeed. But we'd like to, obviously, as a Department of Labour, like to credit the work that has been done to both the employers, the employees, because we have met extensively with them over time, and also our inspectors. Our inspectors over the last year, between 1 April and the end of February this year, have done in the region of 26,669 inspections. Now, in terms of what you're raising and to see the effectiveness of the inspectors, as an example, you'll remember that it is a compensation fund with two mutuals who are registered with the compensation fund. And in both cases, in the case of the Rand Mutual, they reflected 11 fatalities, and the Federated Employers Mutual, which deals with the construction sector, has in fact recorded about 2 fatalities. The rest were under the compensation fund as such. Now, a very interesting thing, if you would like to see the effectiveness of the inspectors, you can have a look at the number of inspections that have been done in the construction sector. That has been in the region of, I believe, over 3,000 inspections plus, and they had a compliance rate of roughly 76%, and you can see that they have only recorded about 2 fatalities, which, in my opinion, while obviously not a happy scenario, the effectiveness of the inspectors, I believe, can be seen there. If you go to the Rand Mutual side, and I would like to just reflect on the fact that they do more than just the iron and steel sector, but in this case, the 11 fatalities, if you look at our iron and steel sector, we had a compliance rate of just over 50%, and in the manufacturing sector, I think it was around about 49% in that sector from the inspections that were observed by the inspectors. So in the 26,000 inspections, of course, we had an overall compliance rate of about 59% of employers on the first inspection. The inspectors would go back for a follow-up inspection, and on the following follow-up inspection, you'd find that most of the employers would comply, and that would obviously be to the benefit of the workers at the workplace. Now, we are saying the hard work of our frontline workers, the inspectors, has in fact paid off, and we will continue along the lines that we have with our partners in business, in organized labor, the Department of Health and its entities, and so on.
Perhaps let's look at definitions now. When you say 52 deaths recorded in workspaces, what are the parameters of the definitions of those workspaces? As you know, the mining fraternity continue to work for a large part of the time. Are healthcare workers also included within that definition or within that number?
I just want to reflect on the fact that, as you know, the sectors are not all together. Different sectors are covered by different bodies. So you'll find, as I indicated, the Federated Employers Mutual is covering the construction sector specifically. and so on. And you'll find that we have encouraged, obviously, where healthcare workers have fallen sick, we have encouraged them to report the matter to the compensation fund. They do sit on various bodies within the compensation fund, so we're able to interact closely with them. Not only them, but the Department of Labour prides itself on interacting with its tripartite structures in organized business and organized labor. So in terms of defining, you will obviously need to look at different sectors in terms of different things. I'll give you a simple example as well of, in terms of the Occupational Health and Safety Act, certain things get reported to the Department of Employment and Labour Occupational Health and Safety inspectors. Other issues get reported to the Mines Health and Safety Council, and so on and so on. So there are different bodies covering different things, and so too for your compensation side. There are two areas there that are covered by two different bodies.
Now, the compensation funds say they haven't reported a surge in the number of claims that were lodged, with only 19,000 figures reported as of the time that we had these figures here. What is the dynamic, and what type of arrangements are being made for workers who perhaps wouldn't have any sort of medical aid and wouldn't have the means to be able to pay for any sort of medical assistance?
Look, the compensation fund, and of course my discipline is occupational health and safety specifically. It would have been preferable if you had the compensation fund sitting here as well, responding to some of the questions. But in the case of the issues that you raise, I think they have put out a guideline being very specific in the type of issues that need to be looked at before anyone reports any cases to them. They were very specific, and in the figures that you've quoted, both for national, that is the country figures, versus the occupational related figures, you can see there that there is a difference, of course, in the type of reporting. Now, the emphasis has to be that it is work-related infections that must get reported, which means that the employer has to investigate thoroughly any case that is reported to the employer, and then they'd have to obviously make sure after that they report it to both the Department of Health as well as the compensation fund. In which case, that will also come through the inspectors.
And what are the measures that have been put in place specifically within your area of focus that actually accounted for the relatively low number of fatalities?
In our case, every time a direction was published by the Minister of Employment and Labour, we trained up our inspectors to try and make sure that they were au fait with what was written in the direction. You'll remember that we are on the third direction, and we hopefully will be moving shortly to the fourth direction, which could touch on issues such as vaccinations. Now, in relation to the refinement of what we are talking about in the direction, you'll recall that we, despite us having the Occupational Health and Safety Act and the regulations, and in this case, we also have the regulations for hazardous biological agents that we can, in fact, operate with, but we also have the directions that were published with which the inspectors also utilize. So in this, we have trained up not only our clients, we have taken them through this through workshops. We have also taken our inspectors from time to time through the different pieces of legislation and how they are to implement that legislation on the floor. In other words, ours is to offer a service to our clients, and in terms of our vision, to try and promote a productive environment for the workers and the employers out there.
And have you, as yet, perhaps looked into the vaccination processes that will be put in place and how that will perhaps roll out within the sector?
Well, for us, we have a small role to play, but this matter is being discussed at NEDLAC at the moment. And as I said, something should come out shortly in relation to this. But what I'd like to inform your listeners to is the fact that the regulations for hazardous biological agents is in the process of being reviewed. And in that regulations, the future will be that we cover pandemics, which means that all employers in future will need to make sure that they cater for pandemics based on what is contained in the regulation. So we won't have an area that, let's say, like we had now, where there's a total blank situation and then we all have to run around. What we are hoping for is that with what we're going to put in place shortly in the regulation will assist clients for any future emergency.
Well, thank you very much for that information, Mr. Szana. That was the Chief Inspector at the Department of Labour, Mr. Tibor Szana.